Very good morning, my dear students. I am Dr. Parvez Ahmad. Today I am going to talk about the tocolytics. Tocolytic agent is also called uterine relaxant. These are drugs which delay the uterine contraction and postpone the preterm labor is called tocolytic agents. These are the learning objective. At the end of this session, we are able to understand different type of tocolytic agents, mechanism of action, and side effects of the tocolytic agents. Now, see the here examples of the tocolytic agents. First one is called beta 2 agonist. Examples are ritodrine, isoxapirin, terbutaline, salbutamol. But mostly ritodrine and isoxapirin we have used to prevent the preterm labor. Now, second one is the calcium channel blocker, like nifedipine, nicardipine, like drug we have used. Now, next one is the oxytocin receptor antagonist. We know that oxytocin is responsible for the uterine contraction. That's why their antagonist we have used for the prevent the uterine contraction. Now, next one is a magnesium sulfate. Nowadays, magnesium sulfate is a drug of choice in case of the preeclampsia and eclampsia for the prophylaxis and as well as the treatment purpose. And these have additional fetal neuroprotections ability. Now, next one is the prostaglandin synthesis. We know that role of the prostaglandin, which has a strong uterine contractile ability. That's why they are inhibitor like NSAID, like indomethacin aspirin, like drugs we have used to prevent the prostaglandin synthesis. Now, the next one is the nitric oxide donor, like nitroglycerin also we have used. Now we move to the individual drugs. Now the first one is a beta 2 agonist. Examples, we know that examples are Ritodrine, isoxapirin like drugs. Pharmacokinetics, these are drugs we have usually given IV infusion in dextrose solution. We can't give it the normal saline because may cause maternal pulmonary edema, may cause increase the maternal uh, fluid overload. That's why we not use along with the infuse with the normal sunlight. Now the mechanism of actions. We know that their action mediated by beta 2 receptors. These are drugs which bind with the beta 2 receptor and stimulate the adenyl cyclase, and adenyl cyclase convert more ATP to CMP, and CMP which inhibit the MLCT and finally inhibit the uterine contraction. These are the mechanism of action of ritodrine like drugs. Now the side effect, the adverse effects, we know that they are the sympathetic drugs. We have seen all the sympathetic activity like tachycardia, tremor, anxiety, palpitation, all the side effect we have seen in this particular type of the patients. Now the contraindication, these are drugs not given in the hypertensive patients, and those patients we have already receiving the beta blockers. Now we move to the next one. Next one is a calcium channel blockers. Nifedipine like drugs. Generally, we have given orally 10 milligram every 3 to 6 hours. And what is the mechanism of action? These are drugs which directly inhibit the L type of calcium channel in myometrium. And finally, inhibit the entry of the calcium. And finally, muscle of the uterus is relaxed. What is adverse effect related to this nifedipine? We know that they causes vasodilatation, may cause hypotension, headache, plus these are the important adverse effect. But what is the advantages for this nifedipine like drugs? Because nifedipine like drug have a lesser side effect. That's why these are drugs nowadays preferred in case of the prevent the preterm labor, and they are the drugs we have used the any stage of the gestations. Now move to the next category of the drug, magnesium sulphate. It is a very important drug nowadays because these have a fetal neuroprotection ability. That's why these are drugs we have used, especially in case of the preeclampsia and eclampsia-like condition. These are given either IV or intramuscular. How does it work? Basically, these are the antagonistic action of the calcium and also inhibit the calcium channel. These are the mechanism of action of uh, magnesium sulfate. And also have additional mechanism. They are the drugs which decrease the amount of acetylcholine release at the input by motor nerve impulse. Adverse effect like flushing, nausea, headache, drowsiness, blood visions. And these are drugs you can't use more than the 72 hours because if you have used more than the 72 hours may cause neonatal hypocalcemia. Now the next categories of the drug, oxytocin antagonists. These are drugs widely used in European country. Okay, uh, Atosiban. The example is a single drug. Atosiban. They are given by the IV infusion. And what is the mechanism of action? They are the drugs which directly antagonize the oxytocin receptor. Adverse effect: nausea, vomiting, may cause chest pain. Now move to the next categories of the drug, prostaglandin inhibiting agents. We know that prostaglandin inhibitors like NSA, non-steroidal anti-inflammatory drugs like indomethacin, aceclofenac, diclofenac, aspirin like drugs we have used to prevent the synthesis of prostaglandin. Now next one is a nitric oxide toner. These are drugs. This altriniate generally we have used in case of the angina, but here also sometimes we have used as a transdermal patches. Okay, these are drugs which stimulate the guanylate cyclase and release the CGMP from the GTP, and this CGMP inhibit the MLCK phosphorylation, and finally muscle of the uterus is relaxed. These are the mechanism of action of the GTM. So this all about the tocolytic acids. Okay. Do you have any question, my dear student? Okay. Now the question is for your assessment. A 32-year-old woman is preterm labor. At 30 weeks, needs to delay delivery for the 48 hours to allow corticosteroid action. Which tocolytic agent drug is most appropriate for these conditions? Options are oxytocin, terbutaline, ergometine, misoprostol, and carboprost. Which one is the right answer? Here B, terbutaline is the right answer. Beta 2 agonist. Now move to the next question. A 29-year-old woman is preterm labor with eclampsia is given a tocolytic that also prevents seizure. Which drug is likely used? Options are Ritodrine, terbutaline, magnesium sulfate, atosiban, Nifedipine. Which one is the right answer? Just you recall my lecture. Magnesium sulfate. Very good. Thank you all of you.